director within the Okay, we're being recorded. And chair of the SURSAC committee. And as always, thank you. You're all contributing a great deal of your time, of your expertise, not only in these meetings, but many of you have signed up for subcommittees that are working on proposals for the overall plan. And others have had, side discussions and stuff between these meetings as well. So I know you're thinking a lot, you're contributing, and for that, I really appreciate it. We do have a full schedule here for our next couple of hours. We're looking forward to seeing where the committee is in terms of thoughts on recommendations for possession, which is pretty much the entirety of today as we had led up to. I will turn it over to Michelle real quickly, who's going to lead us through some of the formalities of the meeting. Then I'll jump back on here and we'll get going with the day. So again, welcome and thank you for being on here today. We'll try to do our best to use your time wisely here for these 2 hours. So Michelle? You're still on mute. There you go.
All right, I'm good. Okay. Thank you, Michael.
You're good. You're good.
Okay. All right, so as usual, we'll just want to go over guidelines for the meeting. So this meeting is being recorded and will be posted to the HCA ESB 5476 webpage. It is open to public disclosure, so please do not disclose any private or confidential information during the meeting. Also, for public feedback, there will be 20 minutes designated for public feedback near the beginning of the meeting today. Each person who wishes to share will have 3 minutes to provide the feedback that they have. Non-committee members will remain muted until it is time for them to provide feedback during this time. If you have feedback that is not provided during the public feedback portion that you wish to share, that can always be provided submitted via email to hcaesb5476@hca.wa.gov. All right, and I think now we'll just move right into attendance. Let me stop sharing that. And we'll go ahead and start with Michael Langer.
Present.
Amber Leaders. Senator Dingrad.
Good morning. I'm here.
Good morning. Senator Braun.
Here.
Representative Davis.
Good morning.
Good morning. Representative Griffey. And I know Caleb isn't able to make it today. Don Julian Saucier.
Good morning.
Good morning. Kiera Fisher. And I know Alexi Orr is also absent today. Amber Daniel.
Present.
Hey, Amber. Brandy Flood. Stormy Howell.
Good morning, present.
Good morning, Stormy. Chad Enright.
I am here.
John Hayden. Sarah Melfi Klein.
Here, good morning.
Good morning, Sarah. Sherry Candelario.
Good morning.
Good morning. Hallie Birchinall. Teresa Adkison.
Good morning.
Good morning. Sarah Gillard.
Good morning.
Good morning. Danelle Tanksley.
Good morning. Present.
Good morning. Malika Lamont.
Present.
All right, thanks, Malika. Addie Adwell.
Present.
Thanks, Addie. Kevin Ballard.
Good morning. Present.
Good morning. Hunter McKim. Kendall Simmons? And is Rep. Taylor here?
Good morning, here.
Good morning. And Rep. Mossbrucker? All right. That does it for
Michelle?
roll. Yeah.
I'm sorry. Thank you all. Thank you for doing the introductions there, or the roll call. I think for today, because we are going to do some polling and some voting, it sounded like one of our representatives is not here, and two alternates are. So I think we need to think about who's going to vote for the one that's not present. I believe was it Representative Griffey that's not on today?
That's right, but I think Rep. Griffey's alternate is Rep. Mossbrucker, who is also not here. So we have Representative Davis and alternate Jamila Taylor. Yeah.
Okay. Thank you. Just thank you for clarifying that. That's going to be important later on. So I appreciate that.
Great. So next up is the conflict of interest update. Michael, did you want to explain this one, or do you want me to?
Sure. No, I'll take this. We've tried to be responsive to the desire of the committee to have some direction around conflict of interest. We had checked in with some of our legal minds on how to best do that before the last meeting. When we came back, it came back as a pretty robust policy, if you will. And we heard feedback from that was kind of going, maybe swinging too far the other way, and was really going to kind of conflict and constrict what was able to be conversation amongst committee members. So we've taken it back again and looked at this and said, what we're really trying to do is just have transparency in terms of who's involved in what programs as we have these conversations. So I don't know if you want to show it, Michelle, if it was out. We sent it out, I believe. But the real intent here is if you're involved in a project and that project's being discussed, please acknowledge that. Please let us know that, this is project XYZ. I'm actually a staff member of XYZ or a lead XYZ or somehow involved in XYZ. That's not going to prohibit you from being part of the conversation. It just acknowledges so that the rest of the committee knows that you have some engagement and some involvement with that. And hopefully that would be sufficient, and that we're really going to go on an honor system of people stepping up and doing that type of acknowledgement. So, Michelle, I don't know if we wanted to share one more thing. There is a component of state employees that we still have our ethic laws that we have to stand behind or stay with in. And I think we sent out a reminder about what those are or a link to it. So hopefully we can go with the spirit of that as a committee, that acknowledge if you're involved and what that involvement might be. And if you do get to the part of voting and you don't feel like you can be impartial in the voting or, something like that, you're welcome to abstain, from that voting. So any questions on that? Do we want to show it, Michelle, real quick, just so we can be clear and then see if there's any comment? Hopefully we found the sweet spot on this one, folks, and we can continue with our business here. Okay, so here we go. You can see it here. While there's no requirement for SURSAC to implement a formal conflict of interest policy, committee members have requested guidance on how to handle the situation where there may be beneficial interest in SURSAC's actions. Members are responsible for ensuring their own compliance with these guidelines, as I mentioned. We'll go in the honor system with that. The guidelines, if a SURSAC member has a beneficial interest in a SURSAC action decision recommendation, the member should disclose that information to the rest of the committee. If the member feels they cannot vote on the matter in an impartial way due to the beneficial interest, the member should recuse themselves from the vote related to the recommendation. Members' contribution to discussion and sharing their personal and professional expertise is encouraged at all meetings. And then there's a couple examples below that might help in the clarification. So And then at the bottom is the note about state employees. So I'm going to pause here and let you take maybe a minute to look that over again if you didn't have a chance to look at it last week. I will also acknowledge from last week that going forward, we hope to get the information. I know the notes come out earlier, but we hope to get the agendas out earlier. Sending them out on a Friday for a Monday meeting is not ideal and is really put stress on members that we don't really want to have there. So we acknowledge that, and we will do all our best to get that information out sooner than later. In terms of conflict of interest, any additional comments or questions? I don't know that we need to take a formal vote on this. Hopefully this is something that we can all work within. Okay, hearing none after the uncomfortable pause there, or comfortable pause, however you want to put it. I think we can go ahead and move on, Michelle, and on the agenda. And I guess I'm up next, so I'll just move on to myself. And thank you all for the feedback, by the way. I know those things are important. That they're not the content of things, but the structure and the engagement is important how we do that. So thank you for the feedback over the last couple of meetings about conflict of interest. New member introduction, and I know we have a new member, and Stormy Howell, and I did have an opportunity to meet with Stormy. Michelle and I did prior to this, but I believe this is the first time Stormy's been introduced to you as a full committee. So Stormy, thank you for being here today. And we do pause at the beginning of each meeting and give new members a chance to say hello, share a little bit about your desire to be part of the committee, and just let us know who you are. So Stormy, the floor is yours. Thank you for being on this morning.
All right, thank you very much for having me. I'm really excited to be here. So my name is Stormy Howell, and I am representing the Lower Elwha Clallam tribe in Port Angeles, Washington, which is on the Olympic Peninsula. Just by way of a little bit of background about me, my previous career, I was a deputy prosecuting attorney here in Clallam County, and did that for 6 years, both in the criminal and civil division. During that time, I was on our county's drug court panel as the prosecuting attorney's representative. I later went on to become the drug court coordinator for our county, and did that for several years before transitioning into my current position, which is the treatment program manager for Clallam Counseling Services, which is a outpatient substance use disorder treatment program owned and operated by the Lower Elwha Clallam tribe. So I have a lot of background with both the legal system and treatment services and the cross section between the two of them, which has led me here today. I've been following what's been going on, reading transcripts, watching meetings, getting caught up to speed on everything that the committee has participated in so far, and I'm really excited to be here. So thank you for having me.
Absolutely. Thanks for joining us, Stormy. I appreciate you spending the extra time to get caught up a little bit before today's meeting as well. So it was nice to talk to you.
Thank you.
I'm going to move on and ask Kevin Ballard. Kevin, would you take a moment and review our committee norms and expectations before we get into the content of today's agenda?
Sure thing, Michael. Thank you. Assume good, positive intent from everyone. Consider diversity, equity, and inclusion and tribal impacts in the work we're doing. Offer both and as opposed to either or. Show mutual respect. Be solution focused. When identifying a barrier or systemic problem, offer ideas for potential solutions as well as to inspire progress and creativity. Be fearless and willing to share innovative ideas or dissenting opinions with confidence that they will be heard.
Thank you, Kevin. Appreciate you taking on that role this morning. And at this point, we will, I'm going to turn it over to Blake Ellison. For those of you that haven't had a chance to meet Blake, he is our facilitator for the SURSAC meetings to make sure that we stay on time and get through our agendas each month. So Blake, feel free to introduce yourself again. And I think you're going to start off with some public comment. But
Yes.
Blake, the floor is yours.
Yes. Hello, Blake Ellison. I am with the Healthcare Authority and here to help facilitate the meeting. So we have 20 minutes set aside for public comment. So anybody'd like to comment on anything related to the agenda or otherwise, please, now is your chance to do it. Just raise your hand. We'll give it a minute or so here. Public comment. All right.
Blake, this is Lisa Dugard on the phone. I can't see the chat, but if you can consider my hand raised, that would be great.
Yeah, you bet. We have, go ahead, Lisa. And we had one other hand up we'll get to.
Yeah, sorry for barging in front of whoever that is, and I'm happy to wait. But thank you for this public comment space. I wanted to make two points, and the first is really a suggestion / plea. What is on the agenda today is public policy formation in one of the most contested, fraught, charged, and important areas in American society today. It is easy to, sort of rapidly polarize this discussion, have people go into their corners, and miss the fact that there really is a tremendous amount of common values and common ground in our state. Many of the people on this, on the committee and who are watching attentively share a lot more common views than are likely to play out if SURSAC presses forward today and just votes. And I think in a situation like that, it really is important, if possible, to have a process that can pull those shared values and goals into alignment behind a public policy package that actually meets and accomplishes what most stakeholders need to see in order to get behind something. And that is difficult but doable. I recall the process around Initiative 940 where 940 was going to pass. It was polling very well across the state. There were no obvious legal challenges to it, but law enforcement reached out to the proponents of Initiative 940, which raised the or made it possible to criminally prosecute officers who wrongly used deadly force. Reached out to the proponents of the initiative and asked to talk. And while we who were, supporting the initiative didn't have to talk, we did anyway. And that process, both the changes in approach, which were win-win, and made the legislation better, but also the way in which people chose to stay around the table and hear one another and find solutions that met each other's needs, did good in a way that we're still drawing on today, and that could, I think, be replicated in discussions around criminal legal system and drug policy in Washington, but not in the next 2 hours. So I want to suggest and volunteer to assist with a 940 style consensus building, stakeholder aligning conversation before September 15th, which I know is your deadline, Michael. And if the SURSAC decides to go in that direction, I know that any number of us are willing to put our shoulder to the wheel and try to produce that kind of consensus forming conversation that could actually be useful to legislators. My last comment, if that doesn't happen and you do move forward today, is a plea that the way in which the diversion option is framed in the agenda could actually do quite a lot of harm. There is not presently any limit on the number of times that any criminal charge for adults can be diverted by police in the field. So framing diversion as 3 instances would be eligible for diversion. The implication is that after that, they would not be eligible for diversion. That actually could set us back, not move us forward in the actual use of diversion around the state, and I think that's an unintended consequence. Better language would be diversion being encouraged
Sorry,
or
that's 3
required.
minutes.
Thanks, Michelle.
Thank you, Lisa.
All right, thank you, Lisa. Rep Taylor, did I see your hand up earlier? I'm sorry about that.
I was raising my hand on behalf of Lisa.
Okay, thank you. All right, Thea, you're welcome to speak.
Thank you so much. I just, as a person with lived experience, as an overdose survivor, I just really want to stress the importance of recognizing that criminal legal responses to substance use often contribute to our deaths. And like, for some of us, we've been losing people for decades of our lives. And so I understand that it may be more politically popular to do other types of things, but ending prohibition would be our best bet at my community surviving. So I would really appreciate that the focus be on the absolute best we can do for our communities, and really focusing on evidence-based practice would be really lovely. And I just have a lot of concerns about doubling down on criminal legal responses, as that has been a lot of what has contributed to people I know dying out there. So thank you. And I'm representing myself, not my position at work.
All right, thank you, Thea. Appreciate it. Randy.
Hello, thank you guys for letting me speak. My name's Brandy Flood. I am with REACH. And so the thing that I just want to highlight, I appreciate everybody's comments. For my community, the Black and Brown communities, we have to have a criminal legal response. Yes, people have been hurt at the harms of police, but if we don't do both while we're going for prohibition and all these other things, all these people are going to get lost in the cracks. And so we could intercept it before people even go to jail and give some other alternatives, because the issue is really substance use and not necessarily their criminal activity. We can do something differently. Right now, drug use is criminalized and homelessness is criminalized in our state. And so we have to have some type of interception. We do have evidence-based practices that show how the criminal co-legal response is a way to provide more robust services to these populations. And there's been a lot of populations we've been able to help in working in conjunction with prosecutors and law enforcement. I wouldn't have said this 12 years ago, but I'm saying it now. We've been able to help a lot of people, particularly Black, Brown, and queer communities, change their social situation by resolving their legal issues and reducing or eliminating their encounters with law enforcement by intercepting at zero. And so there's no way for us to really do drug user support without this initial piece, or it's just social services. Social services alone has never worked. And law enforcement alone has never worked. We need to do something that's integrated, and we do have evidence to show that that integrated approach, it's complicated, but it does work. Thanks.
Okay. Thank you, Brandy. And I apologize, Brandy, this is actually for public comment here right now. Malika, I see you have your hand up as well. Do we have any, before we go to Malika here real quick, hopefully, do we have any members from the community that are not SURSAC members who would like to speak? Malika, we'll go ahead and take your comment then.
And I apologize. I thought since Brandy said something that we were allowed to speak during this time.
My apologies. My apologies.
So I would like to piggyback on everything that everyone has just stated, and also point out that this binary process that we're engaging in with this vote is actually in contradiction to the guidelines that we say that we're saying that we have for this particular group. The process that Lisa has outlined around having a more substantive conversation is something that I've been advocating for as well. We can't do justice to these complex issues by having a straight up and down vote. And
and as a member of the SURSAC, I've also noticed that the things that we're going to be voting on are not necessarily worded in a way that's in alignment with the way that they were originally presented. So it's concerning to me from a process perspective that we're engaging in a process that doesn't even align with the values that we say that we're supposed to be following as a part of this group. So I just wanted to make that comment.
All right, thank you. All right, any other members of the public would like to speak at this point? Okay, let's go ahead and move into the next agenda item. Michelle, you kind of want to walk us through what we had planned on doing today?
Yeah, absolutely. So I've got a document to help us through this here that I'll pull up, and hopefully this will be clear for everyone how this is going to work. And just to start off, this is not an official vote. This is more of to gauge where people are at the beginning of the meeting here and what different options you would consider supporting, what versus the ones that you absolutely do not want to entertain. So we're just going to move through these options, and working in some of the feedback that we got this morning, there was, I've added in an option here for make possession of a controlled substance a felony with diversion encouraged. So that's in addition to this one with the, diversion eligibility options for the first 3 offenses. In case anyone wanted that still in there, I'm just adding 2 so that, the more options we have, the better to see where people are at. But I just want to point that out that one is in there now. So make possession of a controlled substance, a felony with diversion encouraged. So how we're going to do this is go through each of these options. If you would support or be willing to work with the option that we're voting on, go ahead and vote yes on that. And if you're not wanting to entertain it at all, vote no on it. You're also welcome to abstain from the vote. And you can vote yes or be in support of as many as you wish here. But at least this way we can start to gauge where the committee is at in terms of the willingness to discuss these different options. And I did my best, we did our best to divide these into distinct policies, and each of these could be built out, built upon, but in terms of the criminal legal response, such as whether it's going to be a misdemeanor, a felony, decriminalized, legalized, these do tend to, those are differentiated, but I think to Malika's point, there can be some both and in here as well. Once the actual criminal legal response piece is decided on. So just trying to keep that in mind. At least I think that's what Malika was getting at before. All right.
Senator Braun.
So Blake, do you want to walk us through the actual voting process here?
Yeah, you bet. Just 1 second here, Senator Braun, and then Rep Davis. Senator Braun, go ahead.
Thank you. So I think you've done a pretty good job of laying this out in levels. The one is missing that I think is worth considering, which is to maintain possession of controlled substance as a gross misdemeanor. There is a significant difference if you're trying to get people into diversion between a misdemeanor at 30 days and a gross misdemeanor, which gives a prosecutor more ability to leverage folks to stay in treatment. I'd like to see that considered. Thank you.
Thank you. Rep Davis?
Thank you. I would similarly to my colleague love to make a friendly amendment and add another option, which there is a very, I think at the last meeting I put a little handy dandy graph from our friends at the Canada Drug Policy Alliance. There is something that exists between decriminalization, the last two, so decriminalization of controlled substances and commercialization, which is this concept of safe supply. So that's something that Canada does. So if an individual is diagnosed with opioid use disorder, they have access to diamorphine, so essentially legal similar to legal grade heroin, but it is not commercialized. It is not commercially sold in the way that we see cannabis, for instance, in the state of Washington has been commercialized. So that would be my, and you can title that safe supply or prescription.
To clarify, is that something that could supplement any of these options, or is that its own type of criminal legal response?
That's a great question. I'm thinking about it in the way that our chart exists, but that is a great point. I guess it could theoretically exist along any of these, and somebody else here can correct me.
Yeah. Michelle, why don't we go ahead and put it on here, and that way, if it does get support, then we know that maybe there's a way of tying a couple together. So
sounds good.
All right. Thank you. Tank?
Yes, I just want to be clear with regard to when we say possession and without getting into the weeds. So is this just a broad statement? You know, a person, for example, maybe could possess one fentanyl pill versus a person that has possessed or is in possession of 10,000. So I think for me, when I just look at the word possession, it's just very broad. And in order to vote on this, that makes a difference for me. So can anyone expand on that?
Yeah, my understanding is that this applies to the personal amounts of possession, so it would not apply to the laws around bulk amounts that seem to be intended for distribution.
Thank you.
But if anyone else wants to clarify, please jump in.
All right, thank you. Malika.
I'd like to go back to what Representative Davis was speaking about earlier. I was concerned because the regulated commercialization was not the conversation that the very brief last minute conversation that we sort of dipped into regarding a regulated supply. Commercialization was never mentioned. So it's concerning to me that, or it wasn't mentioned in a positive context or as something that was necessarily wanted. Having a regulated safe supply initiative, that I think that we need to be a little more clear about what that means for folks, that is more in alignment with a medical model. And this conversation is demonstrating exactly why we need to have a more substantive conversation about this. It is not, this is not something we're going to be able to accomplish in however long we have on the agenda to talk about today. We're not going to be able to make an informed vote on these options based on that. We're still going to do it because that's what HCA has tasked us with, but I just want to note an objection and that we're not doing this justice. So the Safe Supply Initiative is related to a medical model. It can be related to a medical model, and it can also be regulated it wouldn't be full retail commercialization. It's not related to that.
Thank you. Okay, so I think for purposes of this exercise, really what we're trying to do is narrow down the conversation. Again, I think, Michelle, if you had more comments about that, or Michael, any more comments about that, but we're really looking this first round just to narrow it down, not and to expand the conversation on a couple key ones that we can, the majority of us can get behind. So you want to make any other comments, Michael?
no, I think you got it, Blake. What do we have here now? 6 or 7 or 8 options here. Yep. Again, it's really a poll to see, is this something you can live with going forward if it ends up being one of the prioritized recommendations? So if you don't feel like that's an area that you could support, then your answer is no. If you think it is something that can be supported, although it may not be your number one choice, we'll have time to do that a little later. This is just up, down, whether or not this is something that you could live with going forward from your position. So right, I think we'll get a sense of it once we go through. Yeah.
Yep. Okay, and this voting is for SURSAC members only, please. And we'll go ahead and start with the top. And again, if it's something you can get behind, a yes vote. If it's something you absolutely cannot, no vote. And then you're always welcome to abstain. So number 1, maintain possession of a controlled substance as a misdemeanor. So hands for yeses on this one.
All right, I'll go ahead and read names just so it's easier for our talliers. Brandy Flood, Senator John Braun, John Hayden, Malika Lamont, Sherry Candelario, Sarah Gillard, Donnell Tanksley, Senator Jean Grab.
All right, last call. Okay, hands down if you would, please.
Michelle, oh, sorry. I'm sorry, that went pretty quick. I was just going to see if you could take one more second on that.
You want to go? Can we go hands back up, please, one more time on one? Apologize for that. Maintain possession of a controlled substance as a misdemeanor. Hands, keep your hands up, please.
All right. Yeah, Sandy, let us know when you've got them.
I'm seeing 10, Sandy. I don't know if that's what you're seeing, but.
Okay, thank you.
Oh, there's a few additional hands from before. Amber Daniel, Hunter McKim as well.
Okay, do we have them all? All right, I know this is going to be a bit tedious here to raise your hand constantly here, but hands down if you would, please. All right, Sherry, did you have a comment? Sherry, can you hear me? There we go. Thank you. All right, number 2, maintain possession of a controlled substance as a gross misdemeanor.
Do
you want to go to no on this? Yeah.
No vote? Yeah.
My apologies. My apologies. All right, number 1 again, maintain possession of a controlled substance as a misdemeanor. Votes for no. All right, any other votes for no? Please keep your hands up.
It looks like we've got Julian, Addie, Rep Davis, Chad Enright, Teresa Atkinson, Sarah Mulphy-Klein, and Kevin Ballard.
Okay, thank you. Hands down, please.
Oh. Looks like Rep Davis has a question.
Okay. Rep Davis?
Thank you. Yeah, I just wanted to make a comment, actually. I mean, I guess this sort of echoes the comments that Lisa made and that Malika made regarding, I understand you guys frame this as a straw poll, and I appreciate that, but there's a lot of nuance that is really important nuance that's lost in the choices as is. So for instance, public use versus non-public use. You know, there is a scenario in which I can entertain the concept of some sort of sanction for public use versus individual who has, for example, a point in their pocket but is not publicly using, and that is nowhere to be seen. So it's very, will speak to my own experience. It's very difficult for me to kind of check boxes without any of that nuance, which I think probably speaks to why more conversation is probably necessary, because it's a very complicated, complex issue, and my public policy doesn't necessarily neatly fit into the boxes as enumerated here.
Thank you. Michael, you have any comments on that?
No, there will be more conversations as we get through this sort of straw poll, but and if there's something about, you know, personal possession versus public use, you know, we may want to put that down, have people kind of weigh in on whether or not they think we need to do something with public use. separately. I would say just Caleb Bantagreen has been very active. He is not here. He's not officially voting, but he did ask that his wishes be known. And so I'm going to let you know that he would have been a no there, although that vote does not count. So I'll just do that as we go down.
Okay. All right, let's try to continue on. Again, the purpose is to narrow the conversation a little bit and get into those details. So we have gone through one. Oh, I'm sorry, Sarah.
Thank you. Yeah, I have a quick question about the diversion options. I'm wondering why like diversion like to treatment isn't an option for, you know, as instead of a fine or instead of any of like the misdemeanor options. Like why is diversion only coupled with felony? Was that intentional? I'd love to get a little bit of clarity on that.
Yeah, I think what the reason that happened is because when I was going through the notes, the diversion piece was only brought up in terms of felony, and from what we've heard from prosecutors and defense attorneys, as a misdemeanor, the cases tend to not be pursued or prosecuted as misdemeanors. But I suppose we could add an option for if there's any kind of criminal legal response, even as a misdemeanor, right? There's potential for diversion. So that would be another option. Unless anyone else wants to weigh in about that. Yes, Senator Braun, go ahead.
Yeah, I'm just going to back that up. I think it's a really good point. In particular, I think your point on the misdemeanor is valid. With the misdemeanor, it's really hard to get prosecutors interested. With a gross misdemeanor, where you have a longer period and more leverage to get folks into treatment, I think diversion is a very valid point.
So Senator Braun, you put diversion, you put gross misdemeanor in here. Do you want to amend that to put gross misdemeanor with diversion option? Or would you like to
yes,
have a
please,
third
either
option?
as one option or as two.
Okay.
Either way.
Okay, thank you.
Okay, Chad Enright, I think you had your hand up as well. You have your hand up, excuse me.
Yeah. I was just going to say, just as a county prosecutor, when I see misdemeanor or gross misdemeanor, excuse me, I assume diversions. So I just sort of naturally read that into that proposal because that's really what we do, at least what I do with most of our misdemeanors and gross misdemeanors is we would do diversions. So, yeah, so I would just leave that.
Okay, thank you. And Brandy?
Can we name diversions across all of these? I mean, the whole goal of this process was not to criminalize drug users, but even this voting sets it up that way. So can we just name diversions across each one of these 9 options so it's named there and we don't have to worry about people make assumptions the other way?
Michelle?
I could add a version of these that have diversion. I mean, the question of what the criminal legal response should be to drug possession implies that there could be a criminal legal response. So not all of the options are to necessarily avoid that. But the diversion piece for any criminal legal response definitely can become an option. So what I'm hearing is that we have that as an option for a gross misdemeanor, and you would like to see it as an option for misdemeanor as well. And I'm not sure if something's decriminalized, if diversion even applies there. I don't think it does.
For the parts that it does, just for the parts that it does apply, because even though it's assumed, not every prosecutor is going to give that opportunity to the person being charged, right? We know this. Everybody doesn't get the same way, right? So I just want to be able to name it. So that is an option that maybe is forced upon them to do to give people diversion, because they don't always give everybody diversion.
Yeah.
Thank you. Senator Braun, did you have your hand up still?
No, that's an old one, sorry.
All right, no worries. Okay,
Michelle,
I think
Michelle, can you put the votes in that we took? Can you write them in there so that we can just track as we go down
Yeah.
here, please?
Yeah, Sandy and Michael, do you have the tally for the yes votes on that first one?
Yeah, I came up with 10, but the one person wasn't on the original list, so unless I'm not seeing it correctly, John Hayden, I just didn't see it in the member list, but I came up with 10 if that's included.
Oh yeah, John Hayden's a member. Should be
Okay, I
in
just
there,
didn't,
yeah.
it wasn't in the list on this first one, so I just added
Okay, great, good. So is that 11 then?
10.
No, it's 10.
10, oh, 10 total, okay. And then what was it for no?
Oh, sorry, let me get that up really quick. It is 7.
Okay. And I'm wondering now that we have 9 different options, if maybe it would be better time-wise if we just went down with the yes votes. We want
Is that all right?
to, we want to count those.
There's going to be abstentions too, so I think we just need to do it, but let's.
Okay.
All right, let's go.
If you want to go all yeses and all no's, I don't care, but yeah, go for it.
All right, let's go. Let's just go ahead and.
Excuse me, I have a question.
Oh yeah, go ahead. I'm sorry about that.
So I know this is going to set us back 2 minutes, but I really think because a modification was made to number 1 and 2, that we should vote over again from the top and do it right and get the right number of hands. It might be the same, but both were modified.
Okay.
Yeah.
And Sarah? You have a
I
comment?
had the same comment. Thank you.
All right, you bet. Let's do it again. Let's go ahead and go with number 1. Maintain possession of a controlled substance as a misdemeanor with diversion options. How many yes votes, if you wouldn't mind? Hands up. Please keep them up. Okay, we have it.
I got 12. That's what you got, Sandy.
Okay, we'll go ahead and, excuse me, go ahead and put your hands down if you would. Michelle, we'll go with your suggestion here. We'll just go straight down here on the yeses, just in case we have more questions on language here. So question number 2, or excuse me, topic number 2 here rather is, do we want to maintain possession of controlled substance as a gross misdemeanor with diversion options? Brandy, did you have your hand up? Do you have a question? Oh, okay.
Sorry, that was from the last vote.
No worries. Tank, did you have?
No, actually, I'm
okay.
voting.
All right, let's go yes on that one. Thank you. Hands up for yes. For maintain possession of a controlled substance as a gross misdemeanor with diversion options. Okay, we have the count. 4.
Mm-hmm.
Okay, hands down, please. Okay, all right, we'll move on to number 3. Thank you. Maintain possession of a controlled substance as a misdemeanor, punishable only by fine. Jail time cannot be imposed. How many yeses do we have on this? Any
I'm
yeses?
so sorry.
Or...
Can I ask one more question on that one?
Sure.
I think I'm confused, so others might be too. Can that one also be like the fine be diverted for a treatment assessment? For example, how they did in Oregon? I don't see diversion as an option there.
Yeah, I think, sorry, I meant to, I should have added that in when Brandy had made that suggestion. So yes, diversion options there. And then, well, diversion, if it's only punishable by fine, is the question diverting from the fine? Because if it's not punishable by, oh, okay, I see.
Yep.
Oh.
Okay, so I'll just add with options to divert from fine.
All right, so we're going to go ahead and take a yes vote on this again with the word change or the wording changes. Maintain possession of a controlled substance as a misdemeanor, punishable only by fine. Jail time cannot be imposed with options to divert from fines. How many yeses do we have on this? Okay.
Okay.
Thank you.
This one, yep.
Next up, number 4, make possession of a controlled substance a felony with diversion encouraged. How many yes votes do we have on this? Okay. Thank you. Number 5, make possession of a controlled substance a felony with diversion eligibility options for the first 3 offenses. Excuse me. How many hands up on this? How many yeses? Thank you. Any more yeses? We lost a hand there. That's just fine. Okay. Roger that. Okay, hands down, please. Thank you.
Was that just 2?
2? Yeah, it was 2. All right, number 6, decriminalize possession of a controlled substance and paraphernalia and make it a civil penalty punishable by fine, community service, and or waived with the completion of a health assessment. 6 there. How many yeses do we have for that? Please raise your hands for yes. Please keep them up. Okay, any more hands?
And Sandy, if you need the hands to stay up so you can capture who's voting how, please let us know. But yeah, I think we counted 8 here.
Okay. Thank you. Hands down, please. Appreciate it. All right, number 7. Sarah, did you have a comment or question? Oh, okay, thank you. Number 7.
Oh, sorry, Sarah. Sarah's hand went back up. Sarah, did you have a question or comment?
She just want to vote?
Okay.
No, I didn't. Sorry.
No, that's fine. All right, number 7. Decriminalize possession of controlled substances and paraphernalia with no civil penalties or fines. How many yeses do we have on this? Any more hands?
I'm counting 10.
Okay.
I see 9. Is there?
You
can we
counted,
double check that?
okay.
Yeah, 9.
I saw 9.
Okay. Okay.
Yep.
Thank you. Okay, how many yeses on? Thank you. Hands down, please. On the idea of safe supply initiatives. or Safe Supply Initiative? Yeses on this? Please leave them up.
Out of 13.
We have the count. We're good.
14.
14.
Yeah, I see 14. I don't know.
14. Sandy, do you have 14?
14.
Okay.
All right. Thank you. Hands down, please.
Before we vote on this final one, I just want to open to any final comments about how to reword this or break it into two different options, if that's what the desire was for, because I meant to respond to that earlier in the conversation. So from what I had understood, legalization did mean regulated commercialization, like it could be heavily regulated, but regulated commercialization. So if there's a distinction to be made here that makes the voting more clear, let's do that right now before we vote on it. Brandy, did you have a comment?
No, sorry.
Oh, okay. Hunter, is your hand up for comment or? Yeah, Dr. Patinos, go ahead.
Thank you. Can you hear me?
We can.
Okay, so I think if what Rep. Davis was referring to earlier was the administration of opioids in a clinic setting for people instead of whatever other opiate they may be using illicitly, I think, and maybe Senator Dinger or Rep. Davis know, there's nothing. The issue, I can do that now. The issue is if the DEA allows me to use a different drug for the treatment of opiate use disorder. I can't prescribe methadone. That is clear. I'm not able to unless I'm in an OTP, but I don't know about the other drugs. So in trying to give as most useful information, I think that's something we'd have to check to see if that in fact is prohibited. Because I don't ever recall seeing that language, but I have to admit I've not looked to see if we could prescribe morphine or Dilaudid for opioid use disorder in a clinic setting, and there may need to be some permission needed. But I just don't know right now, but we can check.
Thank you. All right, Malika.
I would like to see the word commercialization removed from this because it implies that, you know, the reason why we're managing or running something is principally for financial gain, which is not what this is about. So a regulated, you know, market, maybe that is what we say, like, but not commercialization. The commercialization piece is the part that totally rubbed me the wrong way when I initially read it on Friday.
Okay. Sounds reasonable. Anybody else? Rep. Davis?
Thank you. This is the part where I probably respectfully spar with the wonderful Malika. Cannabis is the best example I can recently point to. We, quote, regulated a market, and in the midst of doing so, created a massive addiction for profit industry with massive incentives for highly addictive, highly potent products, massively proliferated and advertised. So there is not, I just respectfully disagree. To legalize this to commercialize, there is not there's not really a scenario or a world in which you create market regulation where you don't have exactly what happened with cannabis, where you enter the incentives of, you know, science and further distilling and further purifying and further increasing potency and advertising and motivations of profit and big business and investment that comes with market regulation. I can't envision a scenario in which you don't have that. And I'm quite sure I'm the person who said commercialization at the last meeting, because those two are yoked together. Commercialization and market regulation walk together. And I don't want to pretend that what happened with cannabis didn't happen and suggest that that wouldn't happen with other drugs as well.
Good point. Do we want to, how do we want to, want to add a 10th or?
So I'm going to respectfully push back against Lauren. Lauren, I love you. You know that. Anyway, so I'm just going to respectfully push back, though, because a lot of the harms that we were experiencing from the criminalization of cannabis have been alleviated. Yes, there have been. That is the framework that we understand legalization to happen within. It doesn't have to happen that way. There are conversations occurring all across this country that talk about legalization methods that do not I mean, and now everybody's going to think I'm all extra radical. You probably already do. But like, you know, it doesn't have to go with like a complete capitalistic model of where we're like, you know, make money, make money, make money. It doesn't have to go that direction. There are ways to have a conversation about regulation. It can look like an expanded medical market, and hopefully not repeating the same mistakes that we had with the, you know, opioid epidemic that, you know, we're all getting settlement money from now. I mean, there are I think we have enough things that have happened that we can start learning from those experiences and creating a regulated market that can, you know, address a lot of the harms and that can also increase access to, you know, substances that people are going to be using anyway. I mean, like, this is not, we're not going to come up with the answer to have an up and down vote. And that has been my objection all along. Like, we need to have a substantive conversation in order to really make a thoughtful decision. And I mean, supposedly this vote isn't binding or whatever. We'll see what happens in the next phase. But I think that we owe it a conversation. I don't think it begins and ends with how Washington legalized cannabis. I feel like these things, it's a start. It's not the end. Like, we can change things.
All right. Thank you. Dr. Fotinos, did you have another comment? Okay. Sharisa, can you hear me? Okay, Rep. Davis, go ahead.
Thanks. Yeah, and I know we need to wrap this up. And
Yeah, thank
I
you.
love Malika. Malika's amazing. And I think what I would offer is the big distinction for me is that between safe supply and what's being discussed is that safe supply would be for an individual who has opioid use disorder or has stimulant use disorder. Market regulation means that you are giving drugs to individuals who do not have a substance use disorder. And as somebody who cares deeply about prevention and sees the devastation that has occurred with legalized cannabis in young people and psychotic disorder, I just want to make sure that whatever you call it, market regulation contains providing highly potent substances to individuals who do not have a substance use disorder, and that is very dangerous.
Thank you. How should we proceed? How do you want to proceed, Michelle, with this? We want to take a vote on this one, given the discussion?
Yeah, I think so. So it looks like Senator Deeger has her hand up.
Yeah, just to clarify, we're just doing this as a straw poll to see what we're going to go more in-depth discussion for. I would recommend that we leave it as it is. And if this gets sufficient votes to have a more in-depth conversation, that the nuance of regulated versus commercialized happen at that point in time. So let's just go ahead with what was originally proposed and then take it from there.
All right, thank you. All right, let's go ahead and take our yes vote on legalized possession of a controlled substance or substances, create a regulated market. How many yeses do we have? Please keep your hands up. Okay. We have a count.
I see 8.
Yep.
I
Okay.
paid as well. Okay.
All right. Thank you. Hands down, please. Yeah.
Hey, Blake, while you're counting those for a second.
Yep.
Again, I don't know if we're going to do the no's or not, but Caleb had said that anything with a penalty, a criminal penalty associated, he would be a no on, and
Okay.
everything else he was a yes on. So I just want people to be aware of that. It doesn't count in the votes, but just sharing.
Okay. So top 3, it almost looks like top. We have, okay. We have a number of things we can have an inclusive conversation around. We just wanted to get this narrowed a little bit. Do we need to take the no votes? Would folks like to take the no votes? I don't think so. Okay. I see shaking the head. No. Okay. Probably not necessary to do so, but we have, right now we have a top 3, but we also have a 2 8s there that we might want to bring in the conversation as well. So I'd like to take some time now to go ahead. We do a top 4 asking. Well, we have 2 8s there. What do you think?
Can you describe what the next step in the process is, Blake? I think we
Yeah,
talked about that.
so what we'd like to do is then now, Michelle, jump in if you want to here, is then have a discussion about these top items, take some pros and cons, and just have a conversation about maybe how we may want to utilize each of these ideas that were top vote getters, so to speak, and then really have a discussion about that. And then at some point, hopefully, if we time allows, to revote on and come up with some more nuanced solution here for the conversation. So, Michelle, do you have anything to add to that?
No, I mean, since it doesn't seem that there's like, we've got like two really popular options, and then there's a few kind of in the middle, and then a few that didn't have a lot of votes. So, we don't have to limit the conversation to just the 3 highest technically, but, we just wanted to narrow the conversation down to the ones that had the most traction. So,
okay.
How
about we add 6 and 9 then?
Yeah.
Okay. So, and again, we're not necessarily dumping anything. This isn't an official vote or anything like that, but we just want to have a sense for where people are at with the topics for discussion. So really at this point, Michael, if you don't have anything else, I'd like to open up to talk about each one of these.
Yeah.
Go ahead.
I guess, Blake, I want to make sure we're understanding what's going to happen next 50 minutes. So the thought was we would take the top ones at this point, as I understand it, see the pros and cons. We've heard a little bit of that this morning. Let's get a little bit more in, and then ask folks to do a prioritization, and we'll see where we are at the end of the day. And then the question will come, do we need more time? If the group wants to take more time, we need to create more time between now and September. And if we don't need more time, then we'll know where our priorities are. So if we can go to the next page and just start talking about them one at a time, maybe start with the top one, make sure we have adequate time to get through them all, and then do the priority voting.
Okay. Yeah, and Michelle makes a good point that the safe supply can be woven into the others, right? Because it's kind of something separate here. So let's take the top and just have a discussion about maintaining possession of controlled substance as a misdemeanor with diversion options. What are some pros to that? Let's just go pros, cons here. I don't necessarily need to have a debate, but does anybody want to speak positively to this idea of maintaining this the misdemeanor? Anybody that voted a yes on this have feelings about why they thought it was to good reason to keep it on the list, so to speak? All right. Thank you, Malika, for saving me there. Malika, go ahead.
I don't really support this very much, but the reason that I said, or I voted on it was because I was afraid there wouldn't be any will to do anything more progressive. So
Okay. Okay.
I was trying to do harm reduction.
All right. All right. Fair enough. Thank you. Teresa?
We're talking about number 1, right? Yeah, okay.
Yeah.
I am not in favor of the criminalization, but the feedback I've heard from like police officers and whatnot is that there's a real limitation to like, what are we supposed to do? And we're not going to intervene at all because we have no authority here. We don't, everybody's just really lost and confused. And it felt like maybe if we took like a step down approach, I would love to do something more progressive, like Malika just said, but if we offer something that still allows systems that are continuing to be in place, since we're not overhauling all of the systems that are holding this all up, offer the systems an option on how they can support people while still diverting them to something that's more supportive than jail. So I don't like the idea of it staying a misdemeanor, but I also want police to have the support that they need to continue to help this population.
Thank you. All right, Senator Braun.
Yeah, thank you. I kind of have the opposite take of the last two speakers. I think this is sort of the least we can do. I support the gross misdemeanor. I think with this option, you have what you'll see is exactly what we're getting right now, which is virtually no prosecutions whatsoever, and therefore no leverage to get folks into and keep folks in treatment and get them on a healthy track. I think the gross misdemeanor, the prosecutors still have the option of reducing that to a misdemeanor if they think it's the right thing. They also have the option of using the more leverage to get people into treatment and keep them into treatment. And I think there's a lot of concern about jail time or fines. I get that, and I'm sensitive to that as well. But what you find in practice is that's not happening. And I think with just a misdemeanor, nothing will happen. And I think that's actually worse. So this is kind of like the least option I would support. I think the gross is the misdemeanor gives prosecutors more attention, and in particular, I'd like to thank the suggestion to add diversion. I think what we have now with the referral is not working in a meaningful way. And the diversion keeps people in a system that helps them get to a better future. So it's kind of like the least bad option in my view.
Thank you. All right, Sarah?
Thank you. Yeah, similar to the first two people who commented on this, I, strongly feel that substance use disorder is a public health issue, not a criminal issue, and would love to see it treated as such. However, I voted on this one because my fear is that the infrastructure we currently have in place to intercept people and, get them to support does lean heavily on the criminal legal system, whether that's therapeutic courts like drug court or community court models, or the more traditional court system. And we've seen very diverse impacts on, racial minorities and sexual minorities and gender minorities that I don't know if we can really separate that if we don't take it away from the legal system altogether. But I just worry that the public health response won't be robust enough to capture folks who will otherwise fall through the cracks if we sort of pull the rug out quickly, so to speak.
Thank you. Tank?
Yes. So I don't think there's a one silver bullet to figure this all out, and certainly incarceration is not the silver bullet. And then also offering therapeutic services sometimes is not the silver bullet as well. So the reason why I do support 1 and 2 is because I've talked to people throughout my career that said, and this is just a small sample of people that said, it wasn't until I had to do 60 days in jail or 90 days in jail that I actually, thought at this point that I need some help. And then sometimes, I think someone earlier talked about, being able to intercept the people at 0 before jail. So I think that's important too. So I just don't want to not have the short-term incarceration option put out altogether. But I do agree with, with many people that it's not the only solution.
Thank you. Okay, Julian.
Yeah, I just want to say that there's a lot of people that use drugs that are never affected by the criminal justice system, and it's unfairly like executed, I guess I would say. And there's when you introduce people to the system when they don't have any other legal issues, it still keeps it stigmatized, drug use. And we need to work on destigmatizing it, and we need to work on there being that line between doing a crime and needing help and going to help. I don't believe that forced help really works, but I'm not sure it may. But I believe that providing opportunities that are easily accessible is what and desirable and available would be the best option.
All right, thank you. Kevin.
Yeah, thank you. There are some communities, and I haven't heard this discussion. It is primarily focused on saving lives, but two things that I'd like to bring to light is membership on this committee. I would hope that at the end of our tenure here, that we have some meaningful solutions that actually work. There's been a number of comments made by prosecutors and law enforcement that a misdemeanor approach is currently not working within the system. And to kind of what Tank said, there are some instances where incarceration has changed minds, but and I respect what he has to say. Now, my perspective, having been a law enforcement person, is that there are communities and neighborhoods that are directly impacted by substance use in a negative way, where property crime levels are directly related to number of people who are living in the community that are dealing with substance use disorder. So when we were able to take those people off the street, we saw an immediate impact on the number of property crimes that were going down when we had like serial burglaries or serial type car thefts, those types of things. And so I don't hear this portion of the conversation addressed, but there are impacts on communities outside of those dealing with substance use that should be acknowledged. And so, when we finish our tasks here in voting and prioritizing on these things, let's remain focused on a solution that will work, something that will have an impact on the lives of those people that are dealing with this. It will save lives, and it will heal these people from both the pain and the substance use they're dealing with. Thank you.
Thank you. Brandy.
Did you say Brandy?
Yes, Brandy, please.
Okay. Well, I put some of it in the comment. I think that none of our more meaningful option wouldn't include any type of jail time, and it would actually include being diverted altogether. But I guess my biggest issue, and I'll write an email to the whole committee, is that even the fact that we're settling on an option that we all think is a bad option is problematic. We should be going for the best option or envisioning the best option possible. So I just wanted to put that out there on record that I think it's all problematic, and some of the solutions that you guys are putting in here just support the status quo. They don't support people who are Black and brown. They don't support people who are in extreme poverty or unhoused and who are chronic drug users. All these bullets kind of support the status quo. And so it's just problematic altogether, even though I'm participating in the process.
Thank you, Brandy. Chad.
Okay.
Yeah, I was just going to say that, and I guess in my opinion, option number one, that really is the status quo. And does anybody think that this is working right now? I'm not hearing what I'm hearing from the public is that it's not, and people are upset, and this isn't working. And from a practical standpoint, prosecutors are not going to do anything with this. Here's the reality. If this is a misdemeanor, somebody gets stopped on the misdemeanor, they're in possession. At least in my community, they're probably not going to be arrested. This is a low-level, non-violent misdemeanor. They're not going to get arrested. But the drugs are going to be seized, and a referral is going to be sent to the prosecutor to review for charges. We're going to get that. We're going to send those drugs off to the crime lab, and we're going to get the results a year from now. And then we're going to summons somebody into court a year later saying, hey, remember a year ago when you were found in possession of a controlled substance, we're now going to bring you into court and you're facing a misdemeanor. Misdemeanors don't go into drug court. Misdemeanors don't go into treatment courts because there's not enough of a penalty on those. The reality is, at least in my court, for a misdemeanor or even a gross misdemeanor, you're probably going to do 2, 3, 4, 5 days in jail if you haven't been diverted. I mean, the reality is most people are going to get diversions, but if it's, third, fourth, fifth time, you may be looking at a few days in jail. I would rather do 5 days in jail than a year and a half of drug court. And so this isn't going to encourage people to get into treatment courts. It's not going to encourage people to get into drug courts. I think for my purposes, number 1, and I think it was 7, decriminalization, I think those are really, for practical purposes, these are the same things. And, ultimately, I guess the question with choice number 1, that is what we're doing right now. And I don't get the sense that it's working. So that's my 2 cents.
Thank you.
I just want to keep an eye on the time. So we had a few different options highlighted here, and it probably is time to move on to discussing one of the others.
Okay, so let's move down to we had this notion of safe supply initiatives. Hold on to that one here, but let's talk about 7. Because that one did get the next votes. We just heard Chad's comments on that. Decriminalize possession of controlled substances and paraphernalia with no civil penalty or fines. Any comments from those who support this or don't, for that matter? Kevin, you have your hand up? All right, here we go. All right, Julian, go ahead.
Yeah, I just believe that this is the only option to be known that substance use is a health issue, not a criminal issue by itself, and we need to stop treating it like we're doing.
That written down. Thank you, Addie.
Yeah, thanks. I voted yes on this because I don't think people need to be punished in order to incentivize them to access treatment. I think this idea that in order for people to access care, we need to somehow make their lives untenable or more difficult. It just doesn't bear out. People's lives are already pretty difficult. And I don't think layering on additional struggles helps people actually get their needs met around this issue. And I will also say regarding fines, that's just paper pushing. The vast majority of my patients are unable to pay these fines that they're assessed.
Thank you. Senator Braun?
Yeah, thank you. I appreciate the earlier comment that number 7 and number 1 are virtually the same thing and essentially the status quo, because I think you're right. It was just a misdemeanor. There's very little prosecution. But we can't claim the current situation is working. You know, we've seen a huge rise in overdose deaths, and folks have claimed that, well, that's because of a national fentanyl problem. Certainly that's part of it, but when our growth rate in overdoses is twice the national average, you can't make the claim that somehow our current policy isn't contributing to that. It is. It's also not clear that all those are from, based on what I've read, from fentanyl. So I think this number 7 is where we're at now, and people are dying as a result. And I think it's very noble to say, let's get them treatment, let's get them help. But I think the reality is that's not working. Just offering the help is not working. You have to have, in many cases, leverage to get folks to stay in treatment. And yes, it's not a perfect situation, but if you want to save lives, I think this is the wrong answer. It's not working. And that's this is what we're doing right now. If we want to continue it, unless somebody has a magic, wand that's going to make folks all of a sudden walk into treatment willingly, consistently, certainly there are some folks who do that, and we should take that as the first option, but it's not working. And the numbers show that. So I don't think this is the right answer.
Okay, thank you. Rep. Davis?
This is Malika. Oh, oops, sorry.
We'll come back to you here in a second,
Go
Malika.
ahead, Malika.
Oh, go ahead.
And I'm sorry, I didn't mean to bogart. I'm driving. So I would. It is not the status quo what we're talking about right now. These things are still criminalized. We haven't ever had a paradigm where things are officially decriminalized, and we're able to focus our resources on expanding the infrastructure for treatment and care and housing, and we have made an initial investment, that has lasted, and we've had fits and starts with trying to create intervention across the state over the last 2 years, but we have never made a concerted, concentrated, intentional effort in investing in creating services, meaningful access to services for people that experience substance use disorder, that encounter the criminal legal system that is at the scope that we actually need for people to engage in it. We have never done that in Washington State, and we have never made an official policy statement that we will not criminalize simple possession and paraphernalia. We have not ever done that. So I frankly kind of resent the editorial comment that was made by the facilitator, making it sound like that is what we have done already with this particular recommendation. Any de facto effect that's not the same thing as having an official policy position that we are then able to move forward across the board, across our policy and political landscape, to put all of our efforts into creating meaningful access to care for people that use drugs. We have not done that. We have never done that. And to minimize the impacts of fentanyl and fentanyl on our overdose crisis is pretty unconscionable to me. And I'm surprised to hear that and disappointed to hear that, because the evidence does bear out that fentanyl has greatly contributed to the overdose crisis. And 2 years of policy does not negate 50 years of failed drug policy.
All right. Thank you, Malika. Rep. Davis?
Thank you. I just wanted to again remind folks that when we talk about what we're doing currently, what exists today on the 1st of August in the year 2022 is not fully what was put in 5476. The vision in 5476 is truly just rolling out. And again, the primary diversion mechanism is this statewide recovery navigator program. So a statewide expansion of the highly successful award-winning LEAD model. In every single jurisdiction, there's nearly 200 people that have been hired to do this. It's rolling out in everybody's community, and it's just starting. And so we don't I mean, we have tons of data from LEAD, but not from this statewide rollout. We don't really have the data yet on what that looks like, but I can tell you just anecdotally, a friend of mine happened to get hired as the Okanagan County Recovery Navigator Program Manager, and I asked her to send me some success stories, and I'll just tell you two very quickly. This took her about 7 seconds to put together. She says, this is again the thing we funded with $45 million that's just now rolling out. So during the first week of June, we received a social referral from law enforcement regarding an individual who'd been in and out of jail on a weekly basis. She had experienced multiple overdoses in recent weeks and continued to use. Our team, aka the Recovery Navigator team that we funded in that bill, came into contact with her within a few hours because she couldn't initially be located. We established rapport and performed an intake within 48 hours. During that time, we got involved in peer support programming, assisted her in getting housing. She remains highly motivated in her recovery, and in a little over 1 month has gone from interacting with law enforcement multiple times per day/week to having sustainable housing, no interaction with law enforcement, and then she's involved with various nonprofits and Narcotics Anonymous. And then they gave me another example, a woman using methamphetamines, again, got that woman into kind of peer support network and into housing, and she's thriving in recovery and now giving back. That is the rule, not the exception. We've always known that person-centered care and peer-based work and connecting people and treating them with dignity actually works. We've just never funded it. We finally funded it in the form of the Recovery Navigator program, and it's just starting. So it's too soon to say what we have now isn't working, because what we have now is not yet the full realization of what we penned in that bill.
Thank you. I think we're at Sarah.
Thanks, and thank you, Rep. Davis. That actually set me up perfectly for what I was going to get into. Is it feels like we're having this conversation about policy in a vacuum that doesn't consider, where the money that could be saved from not prosecuting these crimes, or where the funds that were established as a part of 5476 and that have already existed, that we can divert to programs to make access to treatment more easy and more equitable. I think it's just really important to think about that these recommendations don't happen in a vacuum. There, of course, has to be those robust prevention efforts, those robust, efforts to get folks into treatment and to improve health equity across the spectrum for people who want treatment being able to access it. So I just want to point out that, with the Recovery Navigator program and other things that we're considering putting into place as part of the subcommittee recommendations and things like that, that is creating, hopefully, a more robust landscape to get people who want treatment access so that we don't have to go the way of the criminal legal system. Now, the devil's advocate in me is worried that won't happen quickly enough, or that we don't have the workforce to support it, which is why I did vote for some of the misdemeanor options. But that is my hope, and I just want to make sure that that's being considered.
Blake, you're on
Addie,
mute if you're trying to.
Yeah,
there you go.
Trying to get off mute here. Addie, can you want to comment? Thank you.
Yeah, hi. I want to add on to Malika's comment about we have actually never had truly decriminalized possession of controlled substances and a treatment system that is meeting the needs of people with substance use disorder, or people who even have a law enforcement contact around possession of substance use disorder. And it's been said multiple times in this meeting when we were talking about option one that law enforcement officers now in the current context feel like there's nothing they can do because they don't have the authority to criminalize this in the way that they have in the past. And to me, that is a real indication that we have never truly tried the strategies that we're looking at now, where a contact with law enforcement could result in something different. So I really want to say, I think we're in a transitional time. I'm holding close the words of Lisa Dugard and Thea from the beginning of trying to be in common values and also trying to remember that the community that Thea mentioned is dying and more and more. And I'm trying not to place the burden of those deaths on the people whose deaths we're trying to prevent. So I think just saying we haven't actually tried number 7.
Thank you, Eddie. Appreciate that. Okay, shall we move on to let's move on to number 9 here. Take some comments on that. Seems to be another angle of this. So folks who voted for legalize, who gave a yes to legalize possession of a controlled substance, create a regulated market. You want to talk a little bit about the why here and maybe some details?
Was that the one that everyone voted on, or was it safe supply?
Safe supply was the
like
one that everyone voted on.
Yeah, I mean, it's important for us to read what's on the paper. Thank you.
So any comments on legalized possession?
On safe supply, or which one are we?
Oh, I'm sorry, Malika.
What does it actually say?
It says legalized possession of a controlled substances, create a regulated market. That's the one we had a discussion about earlier. Commercialized, regulate. Yeah.
I thought that the third most popular one was safe supply, not.
Yeah, we're going to take that as a separate kind of independent. I thought. Anybody want to talk, Michael? Should we move to that one? Michelle?
Well, we have 3 more to discuss in 20 minutes. So whichever order you want to go in, Blake, let's give me 5 minutes or so and see where we are.
Okay.
So if you want to go, you talk about number 9, let's go ahead with number 9 and then come back to the safe supply and then go to the number 6, I guess.
Yep.
I don't care.
All right. So legalized possession of a controlled substance, create a regulated market. Anybody want to throw some support behind this and with their reasons?
If we have a legalized market, then we can actually engage in meaningful research that will be able to look at the actual impacts of substances on people, not within a prohibition-based paradigm, where oftentimes we're measuring the impacts of the prohibition-based paradigm, not the actual impacts of the substance. Doctors will be able to engage with their patients more honestly. We'll be able to look at reduction in stigma so that we can better meet the needs of people that are experiencing substance use disorder, if that is what they're experiencing, or people that are using substances. And we can talk about the real impacts of what substance use actually does to people, not stigma-based, perspectives. We also can dedicate more funding to housing across the whole entire spectrum, including for people that are not to a place where they are willing to or want to engage in abstinence, but that they would be able to, we could mitigate a lot of the harms that, where people are kept away from the resources that they need because they are experiencing the consequences of their substance use issues. Physical consequences, and then part of the legal consequences. There's a number of things that could happen as a result of a legalization paradigm that could improve the lives of the whole entire community. We also would look at potentially eliminating a lot of the violence related to the drug war, both within communities and also within the criminal legal system. There's a number of things that we could discuss, where would people like to start?
Good question. Let's appreciate that. Thank you, Malika. Let's go move on. Kevin, do you have some comments? Still on mute, I believe. Kevin, you still on mute? There you go.
No, I got it. Malika makes great points. But once again, I just go back to, and having heard from our elected reps and senators, the political will of option 9, I don't believe is there in 2022, 2023. And it's certainly not there in my community as an elected person. I believe that, you know, as we move forward with some of these other more not as progressive options at this moment, we may be more successful in the long term, eventually arriving at a place like number 9. I don't think the political will is there. Thank you.
Thank you. Okay, I see no more hands. Let's move on to the Safe Supply Initiative discussion. Does anybody have more detail on this that'd like to share with the group? Some words of pros here, cons here. Julian.
Yeah, I just want to say that I think we need a little to have more tangible definitions for both the Legalize and the Safe Supply initiatives, in order to really have a meaningful conversation.
Okay. All right. Yeah. So maybe folks who have background in this could talk a little bit about it.
So this is Malika again, not trying to cut in front of anybody. But I'm driving, so I can't. Okay. For example, in Canada, there's an initiative going forward where Vanadu, they are the Vancouver area network of drug users, has begun a buyers club where then they go and test the supply, and then it is distributed to individuals. The government is fully aware of this. Then there also is, prescribed heroin from doctors. However, because they still have a prohibition-based paradigm, they are still in the midst of an overdose crisis, even though there is this increased access for a limited number of people. If we want to have a more substantive conversation, there are researchers that are willing to come and speak to this group. So I'm just throwing that out there if people would like to learn more about the process and the research that they have been doing with the BC Center for Excellence. There's federal funding of this initiative. But ideally, what the goal of Safe Supply is that you recognize that people are not going to stop using substances. And if they are using substances, that they use something that is going to be less harmful for them. Also, what has been found through the research is that people are more likely to engage in other health-preserving activities, such as primary care, and their usage often regulates and decreases because they are engaging in the uptake of other healthier behaviors. So, I mean, it's a harm reduction approach. I mean, and that's something that we have reams of evidence in this country as well, that harm reduction approaches result in people taking better care of themselves and their communities around them. But we have also not ever funded any of those efforts at the scale of need in this state or in this country. But that's what the Safe Supply, and in a nutshell. Like I said, we don't have enough time to discuss these things in a manner that would do them justice. But in a nutshell, that's one example of what Safe Supply looks like.
All right, thank you, Malika. Appreciate that. Julian, did you have another comment?
No, but it's since I'm here. Thank you, Malika.
All right. Let's move up to if there's anything else on Safe Supply Initiative. Sounds like we may need more information possibly to have further discussion. Anything on that one before we move to our last topic of discussion, I believe it is. We'll move up to 6. Thank you. Michelle, you mind moving up a little bit? Thanks. So decriminalize possession of controlled substances and paraphernalia and make it a civil penalty, punishable by fine, community service, and or waived with the completion of a health assessment. So this health assessment, yeah, okay. Comments for this or more explanation of this from any that voted yes on it?
I'm just wondering if it's, if I'm clear on this, the choices a person will get if they are caught possessing controlled substances and paraphernalia will be either pay a fine or get community service or complete a health assessment. That's it. Those are the 2 choices, and that's what we're voting on, is that those would be the 2 choices anybody caught possessing paraphernalia or controlled substances would have. Because I don't.
So
I know here in Walla Walla there's like, first of all, getting a health assessment is difficult, and secondly, there's like one outpatient treatment center in town that does them, and it's just, I don't know, it just doesn't seem reasonable to only give somebody those 2 options. So I'm gonna say that diversion isn't really named in this, and I don't like that, and that's all.
You know, Amber, I love, it's Brandy, I love and the diversion piece, but the other, and I don't know how much leverage we have to impact other state policies, but one of the biggest problems with any type of health support, drug support, all that stuff is that we don't really have core pathways in our state to get adequate health care, mental health care, housing, and other resources. And so can we use this group to also create better core pathways for that, for this to actually be a successful policy, really for any of them to be a successful policy? Right now, the only real way to get treatment support is to go to jail or prison, and those are raggedy too. Like, that shouldn't be how people get that, who want it, right? So we need to create some core pathways to get all those services and crisis services to people somehow by leveraging this committee to push that along as well.
Yeah, I agree. This would be a great option if there were, you know, any detoxes or treatment centers in my area in rural, you know, Southeast Washington. So, which there aren't. And if it took less than a month to get somebody in for an assessment, you know, and if that place that you were sending them to for an assessment wasn't directly financially, you know, impacted by the results of your assessment. So, yeah, I don't know. I know it's different in bigger towns and stuff, but out here it's like just feeding the machine, and the machine is clogged.
And I would say that the scope of services are not adequate in the more populated areas either. So it's like, I think that, you know, to the earlier point of, if we could have a landscape where we could actually make investments in the infrastructure that's needed, like adequate investment for expansion into the infrastructure that's needed across the state, that would be really great.
And then I want to also say that, you know, I want to say that most of the people that I know that use drugs are financially strapped, and just adding more fines to things that's not a realistic expectation. You're gonna have a bunch of people with unpaid fines, like worse than we already do, and it's not going to do anybody any good. It's not going to do the system any good. It's not going to generate revenue. It's not going to, it's just going to create more barriers for people to have their license, get jobs. And, you know, it's like, It's like debtor's prison, but you just aren't in the cell.
Go ahead, Michael.
Yeah, Blake, we are at 10:52, so we have about 8-10 minutes to go. I think we've gotten impressions from members in terms of the items that they felt, of the options that are available, those that they felt were most likely to get moved forward as a recommendation to the legislature. Our plan was to go ahead now and vote and get your priorities, have you prioritize 1 through 3. We can kind of see where that's at, but that feels a bit rushed here at 10:52. I think that we can look at it and see where the higher numbers are in terms of options. We are going to need to finalize this priority or this recommendation by the middle of September. And we also have what people are starting to talk about now in terms of, well, we need a broader workforce. We need a bigger workforce. We need more treatment capacity. We need more recovery capacity and outreach and engagement capacity. Those things are coming through on the subcommittees, and it's clear it's going to take longer to put those into a plan to submit to the legislature than the time we have available right now. That too would be due in September in order to get it up in time. So we're going to have to finalize this first step in terms of the recommendation. There was a suggestion made, and I think Lisa kicked it off as a non-voting member, but as a member of the community, which a few members had said they would be willing to spend some time with, which is to have an ad hoc meeting, if you will, basically add a meeting of this group. So I feel like we're at a place where we have to make that decision. Do we want to add one more meeting between now and September 15th and continue this conversation and then vote at that time? If there's some guest speakers we want to bring in that you feel like you want to hear from before you make your final determination, we could schedule that. But if this body is not interested in spending more time, then we are going to have to press for a vote, without that additional information. So I think we need to hear from you all as members today, whether you're in favor of scheduling an additional meeting and bringing in some outside presenters or not. And therefore we can do our planning around that. And I see that Chad, your hand is up. And I think you were part of that initial group that was talk about maybe we need a little more time of dialogue. So you want to go ahead?
Yeah, I mean, I would be happy to be part of another meeting. I guess my only hesitancy is whether any of the discussion that we had today changed anybody's minds on any positions. And I guess that would be my concern, is that I think we started off saying these are our issues that can be somewhat divisive and polarizing, and has it been polarized enough that everybody has sort of dug their feet in on what their position is. I guess at this point, to me, the very narrow issue is decriminalization or having a crime. And if the majority here is we want decriminalization, then I'm not sure having a bunch of us work together on trying to find a criminal response is going to be a great use of time. But if that's something that people are open to, then hey, I say let's do it. But I also don't want to waste everybody's time.
Yeah, thank you, Chad. We could go with our plan and do a quick vote right now and get the priority and see if it did make any difference, and then make the decision. I just know we're running out of minutes here, so we want to make sure. Thank you for your comment.
So I don't think that it's completely a binary, process of like where I'm going to change somebody's mind or that, they're going to change my mind. But I do think that we can gain a better understanding of where we're coming from, and maybe of things that we don't understand about each other. I'm not looking at it as necessarily only like a binary process. I think that it is a process of learning that we all need to go through. And I don't think that we've done ourselves justice to be making decisions or not making a decision about something that a lot of people don't understand. Like, I think that, or that they don't understand all of the implications. I think that we should have a broader conversation, and I think that the purpose of doing that is bigger than just, you know, a binary response of like, I'm going to change your mind or you're going to change my mind. Like, so that's what I would like to put forward.
Okay. Other comments? Okay, we're going to need to hear from you members, whether you want to spend some additional time, whether or not it changes your mind or not, spend some additional time talking about this, or do you feel like you've had enough background and information to make your vote? So I believe the question on the table then is, do you want us to schedule one more meeting between now and September?
Oh, yeah.
So if you are in favor.
Oh, this is just a voting yes?
Yeah. I'm sorry. I'm looking at the
We're
hands
holding our
here.
hands up to say yes? Is that what you're asking us?
I haven't asked it yet, but I'm pretty close to doing that. If you, if you would like us to schedule one more 2-hour or 3-hour session, it would be the last chance to have this conversation, at least in this forum. If you would like us to schedule that between now and September, please raise your hand now, and we'll count, and then we'll make a determination whether the body wants to meet or not. So it looks like the hands are going up now.
This is Malika. I'm a yes vote. I can't raise my hand.
Oh, 14. 5, 6, 7, 8, 10, 11, 12, 13, 14, 15. I have 16 counted. If you would like to forego any further conversation and feel like you're at a place where you're ready to vote on the priority from the committee, go ahead and put your hand up now. Please take it away if you've already voted. But so this is the vote for no more meetings. Let's get to making our decisions. So I see one hand up. Any other hands? All right. So it looks like we have interest in having a discussion about what looks to be, somebody characterized it here at the end, about decriminalization or maintaining a level of sanction in the criminal justice system. And then we will take our vote. I know we're also right at time. Is there anything else that we need to say as we close out here, Michelle?
Not except that I will be in touch with next steps about the that next meeting.
Okay, thank you. And please know that this we do have lots to talk about in terms of what services would be most meaningful for those in the state. Somebody mentioned it earlier, so I'm going to restate it. For the individual that's impacted, for their families, for the communities they live in, you know, these challenges impact us all. So how can we best make create a solution here that supports the individuals, their family, and the community at large? So thank you all. Senator Dingler, like I typically do, any closing comments before we close down today?
I'll just say thank you once again for your engagement and your discussion. And I'll just say what is clear to me, that people are committed to making sure people get treatment. I truly do believe that that is the end goal of everyone who is here. What we're struggling with is the way to get there. Some people want to do the criminal justice system. Some people want to do civil only. Some people want to do public health. But I just want us to all really understand that I have heard everyone with the same goal, that is to get people into treatment and to save lives. So I would just urge everyone to keep that final goal in mind. And I know we will get there. It may be a bumpy road, but seeing all of you guys show up time and time again to have this discussion actually gives me hope. So thank you all.
Thank you so much. And we kicked off with the words about we have more in common than differences. So we'll adjourn with that as well. Thank you, Blake. Thank you, Michelle. Everybody's contributed. Really appreciate it. Take care.
Thanks. Bye-bye.